Faster than a human? Is this the future? A man walks into a clinic feeling fine, no symptoms, no pain, just a routine checkup. A doctor might glance at his chart, ask a few questions, and send him home. But an AI? It scans his eye, and in seconds, it knows the truth. His blood sugar levels aren't just high. His body is already in danger. He has diabetes, and if it weren't for AI, he wouldn't have found out until it was too late. This isn't science fiction, it's happening right now, and it's changing everything we thought we knew about medicine. But the real question isn't how AI is diagnosing faster, it's who will control what happens next. Because in the wrong hands, this isn't just a breakthrough, it's a decision about who gets to live. AI versus doctors. Right now, over 400 million people have diabetes, and millions more have it without knowing. For decades, doctors have relied on blood tests, physical exams, and symptoms to diagnose it. But that takes time. AI is rewriting the rules. At the University of California, researchers trained an AI to diagnose diabetes from a single eye scan in just a few seconds. No blood test, no waiting, no symptoms needed. Another study found AI diagnosed diabetes with 95% accuracy, while human doctors averaged around 75%. And the biggest shock? AI did it 10 times faster. It's not replacing doctors, yet, but it's already outperforming them. And hospitals? They're paying attention. Imagine this. You go in for a routine eye exam, just a quick scan, no big deal. Then the doctor comes back, face tense, voice low. They say the AI flagged something, they say. And in that moment, everything changes. You thought you were fine, but AI saw what no one else could. What do you do? If this fascinates you or terrifies you, tell me in the comments. And if you want to stay ahead of the future of medicine, hit that subscribe button now. Because what's coming next? It's even bigger. A world where AI finds disease before it's too late? Sounds like a medical miracle, right? But here's what no one is telling you. Some hospitals aren't just using AI to diagnose. They're using it to rank patients. A leaked report from a major US hospital revealed AI was being tested to predict which patients were most likely to respond well to treatment, and they were given priority. Now think about that. What happens if AI decides your diabetes is too advanced to treat? What if AI labels you as low priority and no human doctor ever sees your case? Is this the end of medical bias? Or just a new way to play the same dangerous game? Because right now, AI is helping doctors. But soon, it might be replacing their decisions altogether. This isn't just about diabetes. It's about how AI will reshape healthcare. It's diagnosing diseases in seconds. It's ranking who gets treated first. And soon, it may be deciding everything. So, I'll leave you with this. Would you trust AI with your health? Or are we heading toward a world where AI doesn't just predict disease, it decides who gets to live? Tell me what you think in the comments. Because the future isn't coming, it's already here.